Welcome everybody to this mini series. The objective of this series is to give you a basic understanding of trauma. This will be a three-part series. The first part will kind of focus on the criteria that is usually looked at when activating the trauma response. Second part will focus on the members of the trauma team. And last, we will kind of summarize, focusing more on the primary and the secondary survey involved within the trauma. So let's begin. The first part, like I said, is just a basic understanding of the trauma team. So the criteria. When do we know we need to activate the trauma team? So the criteria is organized into four parts. First is the mechanism of the actual trauma. Second is the anatomy. Third is the physiology of the injury of the patient. And then others to kind of summarize it up. So let's talk about the mechanism. First thing you want to focus on when you have a patient presenting is to first assess what was the mechanism that led to that injury. So was it a fall? And we're usually trying to focus on falls more than 20 feet. Was it a high-speed motor vehicle, a collision? If it was the patient the pedestrian? And if they were they hit by a car at 20 miles per hour? Were they thrown from the injury, or were they run over? You also want to look at and see if there were any deaths. Any death within the same compartment as the patient. Any intrusion of the vehicle into the internal compartments. So for example, if there is a more than 12-inch intrusion into the passenger compartment, or an 18-inch intrusion at any sides of the car, or if there was an ejection of an individual from the car. Any of these criteria would qualify as a patient that needs to be evaluated by the trauma team. And also if there was a motorcycle collision over 20 miles per hour. Next thing to look at is the anatomy of the patient itself. So the anatomy, I kind of organized it based on location. So looking at the head, if the patient has any penetrating injuries to their head, if they have any skull fractures, whether they're open or depressed skull fractures, and having the brain housed in the head, let's just talk about the neurology system, if there's any new paralysis or any spinal cord injuries, all of these would classify as a trauma team activation. Any penetrating injuries to the neck, which could be stab wounds or a branch or anything that's penetrating into the neck. Looking at the torsos, again, any penetrating injuries to the torsos, to the lungs, could have collapsed lungs, into the heart, we could have cardiac tamponade, or any chest wall deformities to the ribs and so forth. Looking for a flail chest. Then the next one is going to be the pelvis. This is going to be an unstable pelvic fracture is the next thing to look at. Okay, and lastly is the extremities. Any penetrating injuries to the extremities, either above the elbow or above the knees. Any amputations above the wrist or ankles. Any 2 or more proximal long bone fractures. Or lastly, any crushed, mangled, or pulseless extremities. All of these would require a trauma team. Physiology. So looking at the Glasgow-Coma scale, if the patient has a Glasgow-Coma scale 13 or less, that would qualify as a trauma team activation. Or if the patient has systolic blood pressure less than 90. Or lastly, they have a respiratory rate less than 10 or more than 29 breaths per minute. And others, these are looking at specifically either the patient population or any other predisposing risk factors. So for example, as a patient population, you want to look at the extremities of age, really young or really elderly patients, pregnant patients over 20 weeks of gestational age. Or if the patient has any risk of bleeding, this would be anyone with bleeding disorders or if they're on any anticoagulants. Also, burn injuries would be another predisposing factors. And lastly, hypothermias. Key thing to know as far as these criteria is that if you meet any one of them, it requires activation of the trauma team. So that kind of concludes our part 1. Part 2 will focus on learning about the individual members of the trauma team. So now that we learned the criteria for which we would activate the trauma team, part 2 will focus on who are the members of the trauma team and what are their roles. Thank you. Please subscribe and support this channel.